I am Dr. Sangeetha, a professor from the Department of the Oral Pathology. I teach oral pathology to the students. Today I will be explaining to the students about cast as well as the tooth specimen. Dear students, these cast and the tooth specimens are very important. We have already taught you people about this in the theory class in the developmental disturbances. So here I will be explaining each cast has the tooth specimen and it carries 5 marks in your exams, internal exams. Okay, this is the cast where we have marked the red color. Okay, you have to look into the cast and you have to identify the cast first. So if you see a palatal droopy, then it is a maxillary cast. So since we are teaching about the oral pathology, you have to identify the pathology, what pathology you find in this cast. So here you are able to see the, what is this? Can you able to identify from the theory knowledge? Can you able to tell me this? The red color? It is the talus cusp. So the talus cusp most commonly you see in the lateral incisor and it is present on the lingual side of the maxillary lateral incisor. You have to specify this. So again I want you people to go back and write 8 to 10 points regarding the talus cusp. Tomorrow we will be discussing about in detail about the talus cusp. This is the first cast. Okay. The second cast which shows here is it is present in the midline. Okay. So it is present in the red color mark and again you have to identify whether it is a maxillary or a mandibular. The palatal droopy tells that it is a maxillary cast. So here you have a red color tooth which is the pathology. You have to identify from this. As I told you 5 marks it carries. Identification only 2 marks. Okay. Since it is present in between the two central incisors. So this is not normal. That is an abnormal. In between the two central incisors, any tooth, extra tooth if it is present, then we call it as mesio-dense. It is a type of supernumerary tooth. So when you observe the tooth here only, you can able to see that both the central incisors are drifting apart. Okay. As I have told you, you have to read about the 8 to 10 points regarding this. That is nothing but the definition of this. What are the different types of supernumerary tooth you are going to find out. And also clinical features and how it is clinically significant. Now one more important point you are supposed to read from here is syndrome associated with any lesion if it is there. So you have to jot down the point of syndromes. Okay. Then
action.
So now I will be explaining to you people about the histopathological slides. Okay. As I have already explained cast as well as a tooth specimen, histopathological slide also carries 5 marks. Okay. And when we will be focused histopathological slide under 10x. So have a look into this slide. Okay, the slide which has been focused over here is fordyces granules. Okay, just have a look into the slide. What are the structures you are able to see here? Are you able to see epithelium as well as the connective tissue? Yes, you could able to see an epithelium as well as the connective tissue. Are you able to see a parakeratinized epithelium over here? Is there any sebaceous gland inside the epithelium which is appearing round to oval with a centrally placed nuclei and it appears more clear compared to the other parakeratinized epithelial cells? Yes. Yes, it is. Okay. When you look the sebaceous cells inside the epithelium in an oral cavity, then we call it as a fordyces granules. The next person you can come and have a look into it. You have to see epithelium as well as the connective tissue. Within the epithelium, you have to observe fordyces granules. That is the sebaceous cells which is supposed to be present in the epithelium. So this carries 5 marks again. You have to identify the histopathological diagram. You have to write about fordyces granules. You have to draw the diagram. Okay, and you have to label the diagram. So this carries again 5 marks. If you complete all this, you will get around 5. Okay. So the total marks for the practical exam is 90. In this we will be covering 12 histopathological slide, some 6 tooth specimen as well as cast will be covered. Totally you will be having for the 19 marks. So 18 total number of spotters we will be keeping in that 12 for the histopathological slide and 4 or 5 or 6 from the tooth specimen as well as the cast.